Hey guys, so today we're here with Laura. She recently had a knee replacement, and the biggest things after a knee replacement that we want to work on is getting the knee straight and bending it as far as we can too. That's going to help with her walking and her gait, and it's going to help to keep her from buckling when she does walk. So by straightening it out, so usually you want to take the shoe off too.
Oh, I'm sorry.
Yeah. And as you can see, she's still lacking a little bit of extension is what we call it, straightening the knee. So by straightening it out, it's gonna help her walk a lot easier. So we'll do that. Big thing to work on after a knee replacement. The second big thing is bending. So magic number for functional bending is usually 120 degrees. Laura's doing fantastic with that. So we want to make sure this angle here is 120, and we want to keep pushing it just like that so that she doesn't get stiff. Another big thing after a knee replacement, patients tend to get really stiff around the knee. So we want to make sure we're continuously moving, and we want to make sure our numbers are good and our range is good. So another big thing after a knee replacement, you had some sensitivity here, right?
Right.
That's because when they cut into your knee here, a lot of the nerves come in this way. So it's normal to feel sensitive here, and you are going to start having some nerve pain, some numbness in that area, but it'll go away as things are starting to heal.
Okay.
All right, cool. Do you have any questions?
No, because you're terrific.
Thank you, Laura.